Ms. Megan Linton, PhD candidate. The floor is yours.
Thank you. Is the mic working okay? Great. Thank you for having me here on the unceded territories of the Algonquin people. I research institutions for disabled people, an ongoing phenomenon stretching back more than a century and a half in Canada. As a result, I have sifted through hours of class action settlements, years of inquests, archives, interviews with survivors, all replete with the stories of death, of friends, of roommates, of fellow inmates and disabled people who died by suicide, who hung themselves from the rafters, or died by suicide years after escaping the institution, but still haunted by their experiences inside it. For many years, these suicides were a catalyst for great social change, resulting in government commissions and inquiries into these deaths. Last week, Minister David Lametti expressed the intention of Track 2 MAiD as necessary because disabled people are unable to complete suicides. As a researcher of institutions, the fallacy of this argument is troubling. For the last century and a half, disabled people have been trapped in institutions, away from their community, reduced to a point of efficiency, a mere practicality. Here in these institutions, which were used as tools for eugenics, removed disabled people from society and prevented their reproduction. Today, this same logic is maintained in institutions where access to pleasure, leisure, or pain management are seemingly non-existent. Instead, these institutions, like prisons, long-term care homes, and psych institutions, maintain conditions of neglect, isolation, and such disregard for individual autonomy that it produces depression and suicidality in people both inside the institution and those who fear it in their future. And people are very clear in their discussions with me. They would rather die than live in an institution. Historically, deaths have been one of the few windows into institutions. Sometimes murky windows, as in the case of the Huronia Regional Center, where the deaths were hidden away in mass cemeteries without markers or names. But the view into institutions, no matter how murky, is a view into austerity, privatization yielding bed sores, neglect, and forced feeding. We've had a view inside the institutions where people use MAiD, like Chris Gladders in his retirement home before you pass Track 2 changes. There, where feces stained the floor, instead of cleaning it up, you made changes to expand Track 2. And now the deaths have become so frequent that we are haunted by the possibility of loss at all times. Disabled people are dying en masse in institutions they had been fighting to leave because of Track 2 MAiD. These were beautiful lives, and lives that as a disabled person, we look into the windows of these institutions and we fight as hard as we can for a way out, for all of us, not just for an individual through an individual death. You ask us for the protections of disabled people. It is clear, Track 2 MAiD must be ended. But you look inside these windows, smashed open by dead bodies, and you see people suffering from the conditions that you yourself created. And instead of offering a solution, a help out the door through provisions of accessible housing, home care, and pain management, you offer people death. Do not be mistaken. This provision of death for disabled people under Track 2 MAiD is eugenics, and it must be repealed as soon as possible. We must look at the political economy for the timing of these decisions. Why now, with the increase of pandemics and incurable illnesses like COVID and long COVID? Why now, with pandemic healthcare rationing and with healthcare under the Budget Acts? The expansion of MAiD must be viewed within the context of the economic order with which we live under that is eviscerating the social contract by encouraging government to retreat from its responsibilities to the public's welfare and instead kill us. You feel generous to provide mercy from the austerity that you've designed. To all of you, disabled people do not need your help to die. You have been killing us for years. We need your help to get out of the institution you trapped us in. The only safeguard for MAiD is foreseeable death.
Thank you very much. Thank you to all of our witnesses for your testimony this morning.